And then when the system was designed, you usually build in redundancies to these things. And so there was a redundancy built in so that if the system went down, the backup would take hold and people could still use it. Well, turns out that redundancy, the backup, was never actually connected to the system. So last night, they were able to actually connect the backup to the system, and so that also gives an added protection. So over 62,000 people filed claims last night by 10 p.m. when the site went down for maintenance. The previous week, that was just 17,000. And yes, the demand's probably gone up, but the reason there was only 17,000 is because people were having a tough time getting on. The site was down more than it was even up at given times. And so the fact that that's been able to increase, they used to have the latency on the website used to be as high as 72 seconds. Now it's less than 1 second, and it's been up consistently, which is what we want to do. So that's been a huge effort to do that. To build the capacity, and I've actually told them, look, it's being able to handle it now, but you don't know what's going to happen, so we're getting even more servers in just to make sure that if we see an even bigger surge than we've already had, that the website is able to handle it. We also had people working through the weekend to train hundreds of additional customer service reps so that when people call in, they're able to get a hold of somebody. And so they used to take 3 weeks to train somebody to be in the call center. And I said, what good is that going to do 3 weeks? I mean, people need to get this thing done now. So the training was done this weekend, and so you're going to be seeing more and more people. 250 people additionally started this morning at 7:30. DEO is training an additional 500 people today. They will start taking calls tomorrow. That's 750, and then we may increase even more from there. And then this is in addition, a DEO had previously added additional 59 individuals that are already in place. So the capacity there is increasing. And again, my instructions are, as these calls are coming in, if you have to add more capacity, you got to do it. So we've been in contact with both some of the state agencies as well as some of the private companies about if that's necessary, how do you do it, but they need to be ready to move on that. We also, in my executive order last week, I ordered all the state agencies to pony up people to be able to help with this. Many of these folks have been working from home for weeks now. Some of them are considered non-essential and are basically have been told to stay at home. But we need all hands on deck now. So our agencies and obviously DOH, some of the ones that are really involved on the health component of this, are not going to be expected to produce employees. But most of the other agencies did. So we've identified over 2,000 employees in state government that can step up to help the unemployment compensation claims. I want to thank them for their willingness to serve their fellow Floridians in a time of need. We are in the process of setting up a virtual desktop for remote state employees by tomorrow. This virtual desktop will allow state employees to take phone calls and do data entry with the Connect system. And as the week goes on, we'll determine the exact number of state employees we will need to ensure Floridians are receiving the best service possible. Obviously, you need to have an interaction with the user on the front end, whether it's a phone call, whether it's a website, but then you need to have it processed, and the data needs to be there. I mean, there's certain requirements of the law, Social Security number, driver's license, certainly federal requirements. We got to get that done. And then move the checks or the direct deposit, whatever it may be, forward. I also instructed DEO to create a paper application. Given this time, not everyone has access to internet, and the libraries are closed. It's not always easy. I spoke to Fred Smith from FedEx, great guy, and I asked him, could we use the FedEx office locations, or you guys could print the forms, have them ready for people could fill them out, and then you guys could just FedEx them every night to Tallahassee. And he said they'd be happy to help with that. So we're in the process of working on that, putting that together as well. Now, obviously, if the website's functioning, that is going to take off pressure from the paper applications, but still, we think it's important under these circumstances for people to be able to have that. And we're also working with different leaders throughout the state. I know Mayor Jimenez in Miami-Dade is thinking about having library access for unemployment compensation. So we obviously encourage folks to be innovative with this. I've also asked DEO, and they are doing this, to streamline and increase the number of employees assigned to the application verification process so that the payments can be expedited. So of the 2,000 state employees stepping up, the Department of Revenue, and we have the commissioner here, has offered 518 employees that will be able to help verify employer and wage data. And as a result of this effort, has told me that they think they can process 80,000 claims this week, and before the average number of claims per week processed by the agency was 6,000. Now, granted, they didn't necessarily have a lot of claims at the beginning of this year, but this will be a huge increase over just the last couple weeks when you did have more demand. So we think that that's something that is pertinent and that will make a difference. But at the end of the day, what I've told all these folks is this: we're in an unprecedented situation. You look at any other economic we've had. Some of those are somewhat sudden, but nothing is even close to as sudden as this. And if you look at the claims that are made throughout the history with recessions or whatever, this is so over and above this in a period of time that just simply doing business as was being done in January of 2020 is not going to be able to get the job done here as we're in April of 2020 fighting the coronavirus. And so it's urgent. I think people have been dislocated from their economic security. Many of the people who are white-collar folks, the folks that are more affluent, a lot of them have the luxury of working from home. And so it's a little bit of a change for them. And obviously there have been some part of the economy too, I grant. But I think the folks who've really been dislocated tend to be the more blue-collar folks, tend to be folks who are lower income, who are not able to simply work from home. And so those are the folks through no fault of their own that finds them in this situation. And so all these agencies need to be responsive to that. They need to keep those folks in mind because the reason they're in that situation is really because of government policy, fighting the coronavirus. And we've done a lot in addition to that, and we're going to continue to do as much as we can. Just in the past few weeks, we were able to streamline the unemployment assistance by waiving the work search requirements. In January, that would have been a really smart thing because you should look for a job before you apply for unemployment insurance. Well, in this situation, I don't know that you're necessarily going to get hired. Order the Department of Revenue to be flexible with tax filing deadlines, and DOR has responded by delaying filing deadlines for property taxes and sales and use taxes for businesses adversely affected by the coronavirus. Sales and use taxes are now due on April 30th. Property taxes are now due on April 15th. And we, of course, activated the state bridge loan program. $50 million are set aside for $50,000 loan increments, and small businesses all across the state are able to apply for that. And then, of course, we're also pleased with the small business relief that was in the federal coronavirus relief bill, and I think have had a good demand. I think we've had a good demand signal in Florida for that. Some of the banks have handled it better than others, but I think they'll get it right. But that's a great opportunity to be able to get what effectively will be a grant. It'll be a loan, but then if it's used for payroll, rent, some of the key things, then it can be forgiven. So we appreciate them doing that. And then in accordance with that, because that's so important, today I'll be issuing an executive order that will waive the collection of taxes for small business loans. There's nearly been as much demand as originally had allocated. IRMA reimbursements over $170 million to cities, counties, and hospitals. I tested negative, but at that point, CDC said unless you had come from China personally, that you couldn't get tested. And part of that, I think, was because they just didn't have enough supplies. So we've worked really hard to get as many supplies as possible. DEM has worked around on that. Most of the supplies for the last few weeks have been sent to New York, initially to Washington, now some other stuff in some other parts of so we've had to kind of fight for our fair share, but we are now over 120,000 individuals tested, which I think is huge. I mean, if you look at the improvement in the testing over the last 2 or 3 weeks, it's been a dramatic increase in the state of Florida, and we're one of the top states for testing. We also have now some of the hospitals. Abbott Labs came out with the instant test, so it'll give you a result in 5 minutes. And this is really a game changer for protecting people in nursing homes, protecting healthcare workers, conserving hospital space. So they have sent that. They only have so many, and I talked with Abbott Labs directly. I spoke with the president. I said, up at the hospital, they're coughing with a fever. You test them, and they're negative for coronavirus. Well, then they just got to go home and laugh because you'll be able to get an answer on that. Hopefully the answer is negative. And then I've spoken with some of these hospitals about, we've been working with ACA and the hospitals and like the homes. If you have a nursing home resident at one of these hospitals and there aren't test results available and the person's doing pretty good, I mean, a lot of times the hospitals want to get them back to the nursing home. Well, obviously that could be a problem because if they are positive, then they can spread it. And so if you have this rapid test, and you have someone in a nursing home, they go in negative, then you can put them back, and then you could also spot test some of the staff members to control any outbreaks that you may see in those really sensitive environments. So we're going to continue to try to expand that throughout the state of Florida, and I think that that's something that's really, really important. We're also having a call today with one of the companies that has the FDA-approved antibodies test, focusing those tests on people, who have symptoms, not only 65 and plus, but obviously that's the main area where we're really trying to help people. You have the antibodies test, and I know they're doing research at Stanford to try to figure out, how prevalent are these antibodies throughout the population, both here in the state of Florida and elsewhere. And if it's really prevalent, then that's going to really affect kind of how we approach it. If it's not really prevalent, then again, that would give us some insight into how this virus has actually spread. Initially, I think the CDC looked at, well, you're probably not going to spread it if you're not really showing symptoms. I think that was initially the guidance they gave. Now I think people, and I think you see it with the revised guidance on wearing a face mask, is actually if you are not symptomatic but infected, you very well may be able to spread it, just like if you were doing symptoms. So I think kind of the view has shifted a little bit in that direction. And then the reason that's important, obviously, is because how many people have had mild or really no symptoms but have had this thing? And if you think, potential more freedom to be on the front lines in those situations. So we've put in a big order. We're not sure when that would come, but obviously that would be, I think, a real positive development if we were able to do it. Final thing, and I'm going to have our folks here offer some comments. In the state of Florida right now, we've had contingency plans in place, and some of it's been executed with the field hospitals. I think you'll see some other things that'll be done, but that's being monitored day after day. And so, finally, I just tell the people of Florida, thank you for all you're doing. I think that you're really seeing people take the social distancing to heart. I know our elderly from the very beginning, because we knew that this was a virus that really had a disproportionate impact on our elderly, have really made terrific strides to not only protect themselves but their families. And so just keep doing that. We're in this, but the more people are doing that, the better off we're going to be on the other side of this. And so I want to thank everyone who's worked very, very hard over the last many weeks. We have more time ahead of us, but hopefully we'll get through it, as best we can. But you do have my appreciation. I know a lot of appreciation from the state of Florida. So with that, let me give these folks some opportunity to offer kind of what they're doing. So, Commissioner Zingali, will you just give a little color to what revenue's doing to be able to help and the capacities that you're able to bring to bear?
Well, a little bit of color is probably a good term. A little bit of history. I've been a public employee for a long, long, long time. Many of you in the room for many, many years. Been through every recession since 1970, the Great Recession. I know this may be hard to bear, but for me and my team at Revenue, these are exciting times. We get to work early every morning. We work on weekends, we work nights. There are challenges not only on the child support side, on the property tax side, on the general tax side, but leadership. If you just heard the governor, you can't help but be impressed with his of what's going on. Okay, it's exceptional. A microphone. Oh, that's bad. It's exceptional. When you get an all-hands call, never seen that happen before since 1972, and I've been here a long, long time.